Good morning. How are you? Wonderful. Thank you for asking. Welcome to your cranial nerve exam. Can you remind me what your name is? And is this your first cranial nerve exam? Perfect. And why did you come to get this test done today? Just want to make sure everything's working properly. Very good. And what is your age? Okay. Perfect. And then, do you have any medical conditions or concerns? Okay. Are you allergic to anything? No. So, as a reminder, a cranial nerve exam is a neurological exam. It tests 12 pairs of nerves that come from the brain. So, I'm going to be testing those nerves for you to make sure everything's working properly, just as you said. And all you have to do is relax and follow my instructions, which will be very simple. And you don't have to worry about a thing. I'll take care of you. There are quite a few tests, so just let me know if you need water, if you need to take a break, anything like that. Okay? Alright, so just sit down and get relaxed and we will get started. So the first thing I would like to do is just listen to your heartbeat, if that's okay. So I just need you to lift up your shirt. Very good. And I'm just going to take a listen, so take a deep breath in for me. Very good. And now take another deep breath in. Good. Another one. And then one more. Very good. Alright, well, no concerns there. So now I'm going to move on to a smell test. So first of all, have you lost your sense of smell at all anytime recently, or have you had any changes that you've noticed? You did lose your sense of smell. Okay, and when was this? Last year? Okay, and how long was that? 1 month. Okay, so what I'm going to do then is just have you smell something, and you're going to let me know what the scent is. Okay. Don't worry, they're only good smells. So I'm just going to stick this under your nose. Okay. Alright, so can you tell me what the scent is? Very good. Peppermint. You got it. Let me get my other one. There are 2 scents. I'm gonna have you smell. So here's the next one. I'm gonna put it under your nose again. And what do you smell this time? Very good. Cherry. It's one of my favorites. Alright, perfect. Now, just make note of this. And then next is your taste test. So along with smell, have you lost your sense of taste anytime recently? Just a little bit last year as well. Okay. And now you have your full taste back, you think? Okay. Well, I'm going to give you 2 flavors, and you're just going to tell me what the flavors are. Again, these will taste good, so you don't have to worry about that. So let me just get this set up. Alright, so I'm just going to put a few drops on your tongue. So just open your mouth for me. Very good. Okay. Can you tell me what that flavor is? Very good. It is watermelon. So let me get my other flavor here. And now here is the second one. So just open your mouth again, please. And a few drops. Perfect. Now what about that one? Perfect. You're right. It is chocolate. And that's one of my favorite drops. It's a tasty one. Very good. Well, I don't see any concerns with your taste as well, so that is great. Okay. Now I'm going to move on to a face sensation test. So I'm going to have you close your eyes for me. Very good. Just keep them closed. And all I'm going to do is gently touch your face, okay? So you're just going to let me know if you experience any changes when I touch your face, or if you can't feel anything at all, okay? So I'm touching your forehead. Do you feel that? Good. Now I'm touching your cheeks. Do you feel that? Good. Now I'm touching your jaw. Do you feel that? Okay, good. Okay. And the next part is actually using this cotton ball. So I'm just going to get a small piece. And the same type of thing. I'm going to gently place this on different areas of your face. And whenever you feel it, can you just say yes for me? Good. 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 Very, very good. Well, it looks like all of your facial senses are working. Okay. So next up, I would like to start testing your eyes. So I'm going to ask you to cover one eye at a time, which I will help you with. And I'm going to have you read the lowest line that you can see, okay? Okay, so first I'm going to cover your left eye, okay? And I want you to read the lowest line for me. Very good. Okay. Now I'm just going to reverse it and cover just read the lowest line that you can for me. Very good. Now I'm going to leave both of your eyes uncovered, and you're going to read the lowest line. Very good. Okay, so you were having difficulty with this one, right? Okay, no problem. Well, very good job. I'm just going to take note of that. When's the last time you had a full eye exam? Okay. I may recommend you to go back, just have a better detailed exam to see if you need glasses. Okay. So now I'm going to test something called your visual fields. Okay. So I'm going to ask you to cover your left eye with your left hand for me. And I'm going to hold up my fingers, and I'm going to ask you how many I'm holding up, okay? And then we're going to switch and do the other side. So here we go. Very good. Very good. Very good. Very good. Very good. Very good. Perfect. Very good. Very good. Perfect. Very, very good. So no concerns with your visual acuity or your visual fields. Now for the next set of tests, I'm actually going to dim the lights, so just give me 1 second. Okay, much better. So for these tests, I'm going to be using my pen light here. Do you have any sensitivities to light in your eyes? No? Okay. So what I'm going to first do is just check your pupils with light to make sure that they constrict correctly. So I'm going to shine light over both of the eyes. If at any point it bothers you, please let me know and I'll just stop. But what I'll be looking for is your pupil response. So just keep your eyes open and you can look straight ahead at me. Very good. Start. Good. Good. Just go back and forth. Okay. Very good. I don't notice anything abnormal with your pupils. Okay. Very good. You're doing a wonderful job. Now the next test will involve this pen again. So I'm just going to hold it in place here and then move it closer to you, okay? And then the point of this is to just see how your pupils respond when I do that. So you just want to look directly at this pen light. Here we go. Very good. Very good. I'm going to check your pupil size with a light in your eye and then with a light not in your eye. So let me first just take a look with the light not in your eye. Just look straight ahead for me. Yeah, perfect. And I'm just going to hold this up and see what size they are. Basically, I just want to make sure they are equal in size and that they are round because if they were not equal in size or not round, that would definitely be a concern. Okay. So they look good without the light. Now I'm going to use the light. So just stay still again. Okay, good. Very good. Okay. And let me switch to this one. Same thing, just stay still. They are both equal size and they are both perfectly shaped. Now for the last eye test, I'm going to have you look directly at this pen and just follow it wherever I move it. The point of this test is to make sure you're not seeing any double vision, so just let me know if you do. Okay, so I'm just going to start. Following it. Very good. Very good. Okay. How did that go? Did you see any double vision or were you okay? You were okay? Wonderful. So have you had any issues with your hearing at all lately? Okay, good. So what I'm going to do first is just use my tuning fork. And the point of this is to just make sure that you're hearing the vibrating sound in both of your ears. I'm just going to strike it and then put it on both sides of your ears. And you're going to keep your eyes closed for me. And you're just going to let me know what side you hear it on. Okay. Alright, here we go. Very good. Very good. So you heard it on both sides, right? Okay. Now for the second part of the hearing test, I'm just going to whisper some numbers on both sides of your head. So you just have to repeat those numbers back to me. If you have any difficulty, please let me know. So keep your eyes closed. Okay. 21, 32, 15, 7, 19, 55, 8, 17, 99. Good. 36, 42, 81. Okay, very good. So overall, did you have any difficulty hearing those whispers? You didn't? Okay. Alright, then I don't have any concerns about your hearing. I know that's just a brief test, so I would suggest you see a hearing doctor every year, especially as you get older. It's always important to check your hearing and make sure everything's going well. Okay. So let me check. Next, I think I will test your neck and shoulders. So, here we go. The first thing I'm going to do is push down on your shoulders. Do you have any shoulder problems or pain right now? You're good. Okay. So I'm just going to push, and what you're going to do is shrug upwards for me. Alright? Alright, I'm just going to start pushing and just shrug. Very good. Okay. Good Good job. Just make sure everything's working correctly. And then the next thing I'm going to do is push down on the side of your head. And what you're going to do is just go against the resistance for me. So I'm going to start pushing on this side and just start resisting, okay? Very good. Very good. And let me do this side. Very good. Very, very good. And did anything hurt? No. Perfect. So the last test I would like to do is actually your facial muscles. So first, I want you to open your eyes wide for me. And you're going to raise your eyebrows high and just hold them up. I know it might be a little bit silly, but I'm going to then just push down. Do you mind me touching your face again? Okay. And just don't let me squeeze, okay? Don't let me squeeze them closed. So I'm going to do this side. Very good. And now let me do this side. Very good. Perfect. And then lastly, I just want you to say ah and open your mouth. I'm just going to push down on your tongue with my tongue depressor and make sure everything's working properly in your mouth. So just open your mouth and say ah. Very good. Okay. Don't see anything. Let me just grab my flashlight to make sure. Everything looks good. Perfect. Okay, well, everything is perfect. I don't have any concerns at all. So, at this point, I would recommend you coming back once a year if you feel like it's necessary. I would especially have you come back, though, if you notice any changes to your vision, your hearing, any of your senses, anything like that. Or if you were to have an accident or anything that might harm any of the things that we tested today. Okay? Make sure you always take it seriously. You always want to make sure that you have things checked out. Alright? So I'm just going to write this report for you. And overall, how was your experience? Good. Very good. You were a wonderful patient. And I'm happy everything is going well for you. And like I said before, any trauma, any sensory issues, anything at all, please give me a call right away. And here's your patient form. And you can just take that out to the front desk and they'll make sure it's all on the computer for the next time you come. Okay. Well, it was so nice meeting you. Nice getting to know you. And stay safe, be healthy, and I will see you next time.